another area of interest for you is reversal of chronic illnesses. I mean, the chronic illnesses that you mentioned that you suffered from. Have you been able to reverse those? And what did you do to be able to reverse your hypertension and inflammation? And I can't remember the others.
Yeah,
It
was hypertension. It was gout, prediabetes, and dyslipidemia, where abnormal blood lipids. And as your listeners may be aware, that constellation of symptoms, or diseases, which traditional mainstream medicine considers to be really separate diseases for many parts. There's some overlap. There's growing evidence that these all have a common metabolic basis, and that the things that drive prediabetes also drive gout and also drive these other things. So what I did was, first of all, I was on prescription drugs for all four of those diseases to, quote unquote, control them. What I did was I took a look at, first of all, my diet. I took a look at what I ate, and I was eating a very high processed food diet. I happened to be vegan at the time, but it was sort of junk food vegan. And I made a conscious effort to get rid of processed foods. That's processed carbohydrates, sugars, processed fats, which are seed oils, canola oil, the hateful eight, that people talk about. And also, I don't have celiac disease, which is a gluten intolerance, but I believe that many people are affected by gluten, even at a subclinical level. Gluten is a protein in certain types of grain. And I avoid gluten, but I actually avoid grains altogether. So that's kind of my dietary picture there. That's what I eat. But as you've hinted at, I believe it's equally important not only what you eat, but when you eat. So instead of taking that diet nutrition style and spreading it out over 15 hours a day of nibbling and 6 small snacks, like my mom always told me was the healthiest thing to do, I shrank it eventually down into 1 meal a day. And that's what I do. The rest of the day I drink water or black coffee or something like that, but I have my 1 meal with my family at dinner time. And then for the most part, I don't eat breakfast or don't eat lunch unless there's a social thing that I need to eat a lunch or something like that. But those are the two big changes I did with diet. And then I looked at my sleep, I looked at exercise, I looked at eliminating toxins in my environment. I looked at other things about any deficiencies that I might have, looking at vitamin B levels and various blood markers, and eventually got everything in order. And my blood pressure returned to normal, off the medicines. I don't take anything for the blood lipids anymore. My gout has disappeared. I don't have problems with uric acid anymore. And it's really been, and my prediabetes is also reversed. So it's been game changing for me personally, but also I can see how it can help other people, and I've seen the effect in other people and my patients already.